Hi, my name is Sabrina Ladd. This is a quick overview of my dermatology conditions in older adults. The condition I picked was herpes zoster or shingles. Just for a quick overview on shingles, shingles results from the reactivation of the varicella zoster virus, which is the same virus that causes chickenpox. It appears as a painful itchy rash on one side of the face or body. It usually appears in blisters that scabbed over in about 7 to 10 days and heals within 2 to 4 weeks. Neurological pain can last for a long time after the blisters have disappeared. Treatment includes use of antiviral medications such as acyclovir, famciclovir, or valciclovir. There is a vaccine for it, and the CDC recommends you get 2 doses of the zoster vaccine in adults 50 and older to prevent shingles. And roughly 1 in 3 people will develop shingles in their lifetime, with about half of the cases affecting adults age 60 and over. So this is the shingles virus on light colored skin. You can see it has the primary lesion types are papules. It's erythematous in color. It goes from one side, from over here, from the neck region down over to the arm over here. So it's following a pattern. The vesicles are shiny. Some scabbing and crusting, like up here or down in this area. And the impact of aging skin is reduced elasticity, and it can lead to a more severe breakout. This picture is an example of shingles on medium colored skin. So you can see the papules are grouped together. It's still following a single line or linear pattern or dermatome. It's papules and vesicles. It's erythematous and hyperpigmented, and some of the areas in the skin is darker than the others. You can see the fluid-filled blisters a little better on this picture. Some areas shows crusting and scabbing, like this little dark spot down here. The impact of aging on the skin is the reduced subcutaneous cushioning or fat, which increase the risk of post-therapeutic neuralgia, which is the most common side effect from shingles, which is nerve pain. And the third picture, this is a picture of shingles on dark skin, which she still has crusting. You can see her crusting clearer, and she has blisters still. They're still grouped following the same dermatome in one area. They're localized to that area. It's erythema, which hers is crusted papules. The impact of aging skin on her, because her skin is darker, the erythema is less likely to be seen, so her diagnosis may be delayed. It's also important to point out that her shingles is on her face, so she should see an ophthalmologist to decrease the risk of blindness or going blind. So this is my side-by-side graphic of all 3 skin tones, and erythema and inflammation was the topic I picked. So you can see in the light colored skin, the erythema is bright red and pink and clearly visible. The inflammation is redness and swelling as well. And the blisters or vesicles are clear and they're on a red base. For the medium tone skin, the erythema appears as red, salmon color, or dusty pink. The inflammation presence may be underestimated visually because of the skin tone, and the vesicles are still visible, and often the most reliable sign to diagnose. And on the dark skin, the erythema is often purple, dark brown, or gray. It's never red. The inflammation appear as swelling or skin darkening or shiny skin, and the vesicles or blisters are usually the clearest diagnostic feature on dark colored skin. I will say shingles can be misdiagnosed in these skin tones because even before any lesions or blister or anything appear, the patient can feel tingling or pain in an area days before any blisters or vesicles or pustules appear. So I would say that would be one factor that can lead to a misdiagnosis of shingles. I would say for a clinical implication for FNP practice is to always make sure you do an accurate skin assessment to prevent misdiagnosis or missed diagnosis. Do an accurate assessment to prevent delays in treatment or the wrong treatment. So I would just say always do an good, accurate skin assessment. If the patient complains of pain or tingling or any kind of thing that have to do with the skin, if they say something is wrong with the skin, always take it seriously and look at it and do a complete assessment. And the last slide of my reference slide. So thank you for watching this video. I hope you enjoyed the presentation. Thank you.